Welcome to the Successful Aging in Place series. My name is Wendy Ebner. I'm a registered nurse. I'm the Chief Clinical Integration Officer and Vice President for Home Health for the Visiting Nurse Association Health Group. Thank you for letting me join you today to talk about healthcare delivery in the home. Traditionally, home care or healthcare settings have included the hospital, whether for a planned event such as surgery or a medical procedure, or an unplanned event such as you end up in the emergency room and get admitted to the hospital, as well as skilled nursing facilities such as nursing homes or subacute facilities or inpatient rehab facilities. Then there's the setting of your home, and that's where home health comes in and what we're going to be talking about today. There's skilled home health and private duty, and we'll get into that in a minute. And then, of course, there's outpatient, where you would go for outpatient rehab, you would go out to your physician, go to outpatient for diagnostic testing, maybe even a wound care center. So, for home health, for skilled home health, the frequent conditions that are addressed in the home by the team would be orthopedics. So if you've had a hip replacement or a knee replacement or some kind of a fracture, that aftercare could be done in the home by our team, which we'll talk about more in a moment. Neurological conditions such as a stroke, Parkinson's disease, ALS or Lou Gehrig's disease, multiple sclerosis, those are some of the neurological conditions that we would address in the home as well. Then there'd be chronic medical conditions such as heart failure, respiratory issues such as COPD or chronic obstructive pulmonary disease, any other respiratory condition. And then, of course, diabetes or kidney disease, any of those chronic conditions. Those are some of the things we also could address in the home, as well as medical management skills such as wound care, medication management, and more of that. Our primary focus is on restoring health and function and teaching the patient in the home and or their caregiver on how to manage the ongoing needs and disease process. Typically, skilled care in the home is not ongoing unless a case is particularly complex and requires ongoing skilled services. So when we say skilled care, what we mean is that it's delivered by a home health organization that's licensed by the state, and it's accredited and participates in the Medicare and Medicaid services program. So these services are typically covered by Medicare, Medicaid, private insurance, and it does require that skilled care is needed. It also requires that the patient is homebound, or it's a taxing effort for the patient to get out of the home. And it's intermittent, so it's not 24/7 care, it's not daily or twice a day care, but it's about 1 or 3 times a week. And of course, physician's orders are always necessary because the skilled team works in close collaboration with the physician. So by skilled home care, we'll go discipline by discipline. We're talking about nursing. So nursing would come out and do a head-to-toe assessment and collaborate with the physician on the plan of care, and would deliver skilled care, such as medication management, teaching the patient and or caregiver how to take the medication, what the medication's purpose, action, side effects are, when to take the medication, and what signs and interactions to look for. The other skill could be wound care, so going out and assessing a wound and making recommendations on what treatment would help the wound heal best, and continuing to assess that wound and collaborate with the physician and change up the treatment whenever necessary. Teaching the patient and or caregiver how to care for the wound in between visits, what signs and symptoms to look for, early identifying any signs or symptoms that might progress into a condition where it requires rehospitalization. We want to catch those things early. So we teach the patient and the caregiver what to look for and when to call us so that we can stop anything from happening, so you can remain in the home and not end up back in the hospital. Same for some of those chronic diseases we just talked about, like heart failure. Big emphasis by nursing is what to look for, what symptoms to look for, what to catch early, when to call us, what to do about the symptoms to stop them from progressing, to keep you in the home. Any of the other chronic care diseases we talked about, like the respiratory conditions, pretty much the same. The nurse would teach the patient how to appropriately administer, say, nebulizer treatments or inhalers, things like that. So taking your medications according to the plan, identifying symptoms early, staying out of the hospital. We have other disciplines such as physical therapy, whose primary focus is on mobility, ambulation, transferring safely, and remaining safely in the home. Maybe durable medical equipment, assistive devices. Physical therapy is a big part of the skilled care team, as is occupational therapy, whose main focus is on personal care type activities, such as bathing, grooming, eating, hygiene, again with assistive devices. So occupational therapy's involvement is also sometimes needed, especially on some of those neurological conditions and chronic disease management. Speech therapy. Some of those neurological conditions result in a patient's inability to speak, and the speech therapist can help with both speech and receptive and understanding the spoken word. Also, safe swallowing. Some of the neurological conditions affect our swallowing, so we're not swallowing safely, and a speech therapist interventions can help with that. Another part of the skilled care team we can call in is the medical social worker. And the medical social worker's focus can be on helping with Medicaid applications, helping get a medication covered by insurance, or finding a medication at a better cost in another pharmacy. Sometimes community resources are available to help patients in their homes, and the medical social worker can help with that. Area-wide transportation. So the medical social workers, great part of that interdisciplinary team that we rely on, as are the nutritionists or dietitians, who review the prescribed diet for the patient, help the patient identify what foods in the home fit that prescribed diet, and make any modifications that are necessary. And of course, the home health aide. And the home health aide is the person that comes out and helps the person in their home with bathing, dressing, grooming, meal preparation. When they're in under-skilled nursing services, the RN, the registered nurse, is the one that oversees the home health aide plan of care. They're not that involved with things like housekeeping and running errands and companionship. That falls more under private duty, which is what we're going to talk about next. So in the home, private duty care is more of a custodial nature. So that's when, again, you need something like supervision. Maybe the patient's daughter or son works from 8 o'clock in the morning till 5 o'clock in the evening, and you need private care during that time for companionship, supervision, meal preparation, again, bathing, dressing, grooming. That's where a home health aide would come out under private duty, get periodically supervised by the nurse, and that's typically not covered by insurance. That's typically a private pay arrangement, or there are some long-term care insurance policies that would cover that. So those are the distinctions between skilled home health and private duty home health. Private duty is more custodial, it's the aide, it's a private pay situation, it can be ongoing for as long as needed. Skilled care is more, again, intermittent, short-term, unless it's a very complex case, covered by insurance, and you have the skills coming out of the nurse, the physical, occupational, or speech therapist, the social worker, the dietitian, and the home health aide. So we at the VNA Health Group do cover 12 counties throughout New Jersey and do provide all of those services that we just mentioned, the skilled home health, private duty. We also have end-of-life care with hospice and palliative care. We have our visiting physicians program, where the physician comes out once a month typically to make visits in the home. And we do the remote patient monitoring, which is where if you're under skilled care and cardiac is the primary focus of care, we can bring out a little monitor. It's very small, only takes up a small amount of space on the counter. So on the days, whether you're getting a visit or not from your nurse that day, you go to the monitor, you put your arm in the blood pressure cuff, it takes your blood pressure, it takes your pulse, it takes your oxygenation, you answer questions on symptoms, and it's another way to help on the non-visit days and even on the visit days to identify if anything's falling outside the parameters and needs early intervention to, again, prevent going back to the hospital. We also have a team of wound care experts that help us with identifying the most appropriate wound care treatment and making sure that those wound care treatments are applied early and for faster wound healing. Thank you so much for having me here, and I hope that this has helped to explain the difference in the home care services in the home setting.